Understanding and managing heat events in flying fox colonies. As we know, climate change and flying foxes are becoming an increasingly bigger and bigger issue as far as population goes. Every year, heat events seem to be becoming more severe and more frequent, affecting far more places than they ever did before. Winter starvation events are becoming more frequent and profound as well. Heat events are becoming more widespread and frequent. Heat events are also occurring in areas where heat events have previously never been recorded. The recent heat event in North Queensland resulted in the loss of approximately 1/3 of the remaining population of the endangered spectacled flying fox, with deaths recorded from Townsville to Tully. Many affected camps are isolated with limited access to vaccinated carers, trained carers, or access to veterinary attention. Flying foxes are more prone to heat events or coming down with heat stroke and heat events because they have a very high natural metabolic rate. So animals with higher metabolic rates tend to have lower thermoneutral temperatures. A thermoneutral temperature is the temperature at which they don't have to engage any active measures to maintain an optimal core temperature. Metabolic activity generates internal heat, so animals with high metabolic rates will naturally generate more internal heat. Above an animal's optimal thermoneutral temperature, they need to engage active cooling measures to be able to maintain this temperature. Therefore, animals that have the highest metabolic rates at the time of heat events are going to be the most susceptible to the development of heat stroke and the progression from heat stress through to heat stroke. During the time of year where we tend to have most of the heat events, this is usually the lactating and pregnant females, followed by juveniles, and then lastly, non-pregnant females, and then males. Occasionally, when we have very late events in March, April, we will get males that are more often affected, and this is because they at that time are the most metabolically active, because at least in the blacks and the greys, they're heading towards their mating season. Flying foxes, as mentioned before, have got an incredibly high resting metabolic rate. It's twice that of any non-flighted mammal, meaning that their basal resting temperatures are already quite high. Flying foxes rely on the huge pectoral muscles on their front solely to fly. They don't have any of the helping mechanisms like birds, like hollow bones and air sacs, in order to make them lighter and facilitate flight. Therefore, the incredibly strong pectoral muscles already generate a lot of internal heat. They've also got a reduced ability to avoid dehydration because they're adapted to a mainly fluid diet. They also can't sweat, so heat loss is either from radiation from dilating blood vessels and evaporative cooling. And both of these are very costly physiologically. Animals that are in poor body condition, which is becoming a more frequent problem at the moment facing heat wave conditions, will also be affected far more profoundly because they've got less body reserves to cope and a weakened ability, and they've got a weakened ability to respond and recover. Their bodily reserves of glucose as well as fat will already be too low to also incur the insult from heat stroke. With breeding females being so susceptible to heat stroke and their already low fecundity, the loss of thousands of breeding females results in a devastating impact on the population as a whole. A female flying fox rarely produces more than 5 pups in a lifetime, so this makes these events a real threat to flying fox populations. During a heat event, flying foxes tend to carry out quite predictable behavioural patterns. This is designed because flying foxes are trying to find cooler microclimates within the camp in order to maintain their ideal thermoneutral temperature. Usually they're seeking cooler microclimates within the camp, often within the mid-story. It's found that when camps are fully have an intact structure, meaning an intact canopy, mid-story and understory, these camps are usually far less likely to come down in heat event conditions because animals are able to thermoregulate themselves and find cooler microclimates. They're able to fan and shade seek effectively. Normally, once an animal is starting to exhibit heat stress, or the thermoneutral temperature has been exceeded, radiant cooling is the first to start. This is normally only effective when the body temperature is still higher than the ambient temperature outside. So, what happens during a heat event? So, the thermoneutral zone, or the thermoneutral temperature of a particular flying fox, can be higher or lower depending on the current physiological status of the bat. This is the temperature at which no active measures are needed to maintain that ideal core body temperature. The thalamus in the brain detects if the temperature rises above this thermoneutral zone, and certain behaviors start in order to protect this. So this is either fanning and shade seeking. Blood vessels in the skin vasodilate to allow heat to radiate away and cool the body, which, like I mentioned, is only effective if the core temperature is still higher than ambient temperature. But as the temperature continues to rise, fanning increases, which, because of the large pectoral muscles, will also increase core body temperature due to the pure energy produced by the pectoral muscles. And if the temperature continues to rise, it won't be long before body temperature potentially is also high. Ambient temperature can be higher than that, and this process is ineffective, but also hastens the process from heat stress towards heat stroke. Normally at this phase, when the animal's just heat shade seeking and fanning, the flying foxes are still considered to be just suffering from heat stress. There hasn't been any permanent cell damage indicating heat stroke. Radiant cooling works by dilating the blood vessels, usually in the membranes, which works because the core body temperature is higher than the atmospheric temperature, which means that the heat is likely to escape from the high temperature out to the low temperature, and that results in cooled blood passing through to the rest of the body, cooling the core body temperature. Wing fanning does assist this process by moving cooler air over the dilated vessels, but this is only effective while the temperature outside is lower than the core body temperature. The problem with this is that the body temperature will also continue to rise as fanning continues desperately in an attempt to lower core body temperature. Unfortunately, the sheer metabolic energy that is produced by these pectoral muscles also increases core body temperature and can hasten the process towards heat stroke mentioned before. Evaporative cooling works in low humidity because the flying fox is surrounded by quite sparse particles of water. What the flying fox will then do once radiant cooling is ineffective is start licking the periphery of the body. Whilst this is effective for cooling, it's also very costly to the flying foxes when we need to consider that they've got very limited water stores and very limited ability to concentrate urine. As this water evaporates off the flying fox's body, the core temperature is reduced. As you can imagine, if the animal was surrounded by a very high misting or very high humidity, this effect would be reduced. The risk with misting during this process is that if the flying fox is surrounded by too many water particles, the ability of the water particles that the flying fox has distributed onto the periphery to escape and cool the body is reduced markedly, meaning that we've lost the last of the mechanisms to lower body temperature. So the flying foxes will start wrist and body licking. In low humidity, as mentioned, this allows evaporative cooling, where the water particles evaporate and facilitate cooling. Winds can aid this, but on the other hand, very dry winds can also hasten dehydration and also progress on to dehydration and issues related with heat stress. Once we've reached the point where the body where this is no longer effective, dehydration's occurred, the process towards increased body temperature, rapid loss of body water reserves, means that the process towards heat stroke becomes far more rapid. And what happens now is it means that permanent cell damage has occurred. As the temperatures rise, radiant cooling fails, and evaporative cooling is the only means of dropping core temperature. As we mentioned before, this is exhibited by wrist licking and panting, which, as we've mentioned, is effective in low humidity but extremely costly, as dehydration will occur very rapidly. In high humidity, this is less effective, as surrounding water particles prevent this. If temperatures continue to rise and core temperature rises above 40.6 to 42 degrees, heat stroke occurs and permanent cell damage has already started. Most of these flying foxes are now suffering from heat stroke and are close to their critical physiological limits, which is why management of flying foxes at these stages is critical. Any sort of stress, any lifting or disturbance at this point, anything that pushes them any further physiologically is likely to result in death. Knowing the behavioural stages during heat stroke is incredibly important to know when it's appropriate to monitor and when it's appropriate to mount a response. Normal behaviour, or classified as category 1, is where most of the flying foxes are just sitting normally. A certain percentage of animals will always be fanning, because fanning can be a normal temperature, a normal behaviour as well. A certain number of animals can even be fanning right down to temperatures of 23, and this can be completely normal. So understanding the difference between normal behaviour and the proportion of animals that are carrying out different behaviours is incredibly important. The time of year, ambient temperature and relative humidity, as well as wind direction and strength, should always be considered as an essential part of the information when interpreting any behaviour. The percentage and demographics of animals carrying out such behaviours are also important, i.e., are they pregnant lactating females fanning only versus the entire colony fanning, because pregnant lactating females, as I've mentioned, can start fanning at temperatures as low as 23 degrees because they've got such high metabolic demands. Whilst observing these behaviours is important and can act as an early warning system of arising issues, it's also important to note that these behaviours can be normal. Behavioural progression from animals showing signs of heat stress through to heat stroke will always follow a predictable, consistent progression. And this progression is as followed. Wing fanning, or category 3, as we've mentioned before, is to facilitate radiant cooling. Wing fanning is a normal cooling behaviour in minor heat stress. It's conducted to increase the flow of cooler air over the wing membranes, where the dilated blood vessels full of warmed blood can cool from radiant cooling. And again, as we've mentioned before, it's only effective when the body temperature is still higher than the surrounding ambient temperature. But it can start as low as 23 degrees to 30 degrees, depending on the physiological status of the individuals within the camp and the relative humidity. Monitoring only of the numbers of bats carrying out this behaviour, and any progression from this needs to be noted at this point. Clustering is referred to as category 3A. Bats start to move further down the trees into the middle story vegetation. Thermal imaging during this time has revealed that the bats are actually attempting to move to cooler microclimates within the camp, despite the fact that it seems that it would be silly under hot conditions for bats to start to actually be in close proximity to each other. Bats will continue to fan during this time, and if temperatures continue to rise, eventually they start panting and wrist licking. Whilst this stage does not immediately trigger an alert, bats starting to carry out this behaviour need to be monitored, and response groups need to start to be placed on alert for the possible need of an on-site response. This behavioural stage should be posted on alert platforms, and once confirmed, preparations for response should be coordinated. It's important to note that bats at this stage should never be disturbed, as disturbance is likely to risk bats becoming stressed and taking flight, potentially causing progression to heat stroke and possibly death. Clumping, or category 3B, is when flying foxes are desperately trying to move into cooler microclimates, and they almost look like they're roosting on top of each other. This can occur on the shaded side of trees, under logs, the understory, in tree hollows, the base of trees, on the ground. These clumps are sometimes consisting of bats of 50 plus in numbers. At this stage, flying foxes should not yet be approached for spraying, as many may not tolerate spraying at this point. At this time, the heat stress response personnel should be in place, though, and set up for response should the sensitivity of the roost, location, and resources allow a response to occur. The risk of making these flying foxes raise is incredibly high because they are getting to the point where they're reaching their physiological limits. Panting and risk looking at the tree base, category 4. At this stage, a response should have been triggered and a response shot site should already be set up ready to go if the intervention is suitable for the roost and site. Bats are panting and licking their wrist. Ambient temperature has continued to rise, and clumping in cooler microclimates and wing fanning has failed to lower their core body temperatures. Wrist licking and panting is utilised as a means of using evaporative cooling to lower core body temperatures, but the sheer act and exertion of prolonged fanning as well as loss of fluid often means that a lot of these flying foxes will not only be dehydrated, they're often hypoglycemic or low in blood glucose, and they're also often starting to exhibit permanent cell damage or heat stroke. So some of these flying foxes will appear neurologically very quiet, because they're starting to become very weak and starting to have some damage to the brain from heat. If it's possible to approach, these flying foxes should be checked for the possibility of being able to spray. Bats will become incredibly dehydrated, like I mentioned, and hypoglycemic and vague because of the sheer effort of fanning and heat stroke starting to affect body functions. Bats move to the bottom of the trees, and those with no mid-story may actually fall from the upper canopy with severe heat stroke. At this stage, monitoring needs to be undertaken incredibly carefully. Rescuers need to know bat behaviour and be able to very cautiously approach bats at the base of trees to monitor for any signs of distress and bats trying to lift off. Risk versus benefit must always be measured, because the possibility of saving 10 at the base of a tree but risking 50 or so rising and then dying needs to be taken into account. Rescuers must move away quietly to avoid any flying foxes lifting at this stage if there is any sign that flying foxes are not going to tolerate approach. And it must be noted that there are certain camps where there just is not the possibility of a response. There are some camps where flying foxes are just too stressy and absolutely not suitable for a personal response involving human intervention. Any seizuring animals should only be taken for euthanasia only if a licensed carer is available and other nearby bats are not stressed or show signs of lift or approach. Seizuring flying foxes should not be removed from the camp if there's not someone licensed for euthanasia immediately present, as dying unaided in the presence of humans will be far more stressful for the animal than being left in the camp. During heat stroke, one of the main mechanisms that flying foxes are suffering from is severe dehydration. Severe fluid loss occurs due to panting and evaporative cooling. This can eventually lead to shock, multi-organ damage, and renal failure. Flying foxes will also be experiencing a certain degree of myopathy. Now, myopathy occurs where there's been so much muscle exertion that lactic acid is built up to the point where muscle cells have actually ruptured. This releases myoglobin, which is toxic to the proximal renal tubular cells, usually due to sustained fanning and direct cell damage from heat. This also contributes to renal failure. The brain also undergoes direct cellular damage to the brain and also the associated blood vessels. This can cause brain swelling. This is usually seen as distress and then depression, often seizuring, blindness, coma, and death. The other thing that this can do if animals happen to survive is potentially lower the thalamus ability to respond to temperature changes, meaning that some flying foxes that survive heat events can potentially be more susceptible to developing heat stroke in future heat events. Damage to vascular beds occurs all over the body. This worsens shock. It can cause fluid buildup in the lungs. It also causes multi-organ damage. Gut lining often sloughs, worsening fluid loss, and this can result in a phenomenon called disseminate intravascular coagulation, which is where blood vessels have been damaged all over the body. This then triggers the body to think it has to lay down clotting factors everywhere. These are then used up. Once they're used up, it triggers hemorrhage all over the body. Flying foxes in this stage are rarely able to be saved. Some other things like gut lining, sloughing is something that often occurs down the track once flying foxes survive the initial insult. The only issues with intervention is that spraying bats with water, as we've mentioned, has the potential to be the single greatest tool in preventing mass deaths. However, spraying must be aimed to directly wet the bats, aiding evaporative cooling and sparing fluid loss and myopathy from reaching critical levels. The issue, if all that's achieved is a cloud of humidity around the flying foxes, is you have the potential to create a humidity cloud, avoiding the phenomenon that we saw before, where when the flying foxes lick their periphery, that fluid cannot evaporate away and they've lost their last mechanism of lowering their core body temperature, which can be critical. To achieve spraying, bats must be tolerant of human approach. You need to ensure that other bats will not lift, saving a few but losing hundreds that fly off at a critical time. So this requires very large numbers of trained, vaccinated people to mount an effective, coordinated response at times when many responses are often required at critical times in differing areas all at the same time. The reality of coordinating manual responses to heat events is that if it is possible to spray bats, they'll usually only tolerate spraying at a far later stage of heat stress. It's also incredibly difficult to have the resources and numbers of adequately trained people to mount an effective and safe response at the correct time. So the ability to coordinate a direct response will vary widely on where the event is occurring in Australia, the population of trained vaccinated carers, and the resources that are available. In a lot of circumstances in remote areas where there are a few carers, there may not be the ability to actually do a response as mentioned here, and all that may be available is to go in and save orphans or save animals after the event has occurred. So when, how, and should we intervene? Once flying foxes are panting and risk licking, they are losing significant stores of body fluids in a desperate attempt to achieve evaporative cooling. So spraying must be timed correctly. Bats are clumped down, panting, and tolerating human presence, and no other bats are looking like they're going to lift. It has to be as direct as possible for the colony. It will depend on the colony structure how spraying can occur. You may be able to achieve direct bat wetting with minimal additional stress that must be able to occur. The decision and method of spraying must be made by personnel that are knowledgeable about that specific camp, structure, and bat behaviours. All camps are going to be different and be able to have a differing response. So when we spray in low humidity, what we're effectively doing is increasing the amount of water that's not only available to facilitate that evaporative cooling, but we're also potentially starting to be able to help the flying fox replenish some of those lost fluids. So guidelines for euthanasia in a heat event would be uncontrolled seizuring, a comatose animal, a blind animal, so with no corneal reflex. So that means the actual eyeball can be touched, not eyelid, the actual eye itself, with no blink. A rectal temperature of above 41.5, an animal not responding to cooling measures or subcutaneous fluids and glucose, and any animals with additional injuries. So animals that have been brought in for triage that have fractures, severe lacerations from falling, are not going to survive these on top of heat stroke. Triage needs to involve careful cooling and monitoring of rectal temperature. Animals that are brought in for triage need to be sprayed with tepid water and encourage air circulation. So not cold water, as this can actually stimulate shivering and that can worsen heat stroke. It's also important not to wrap flying foxes in a wet cloth, because this can actually cause the flying foxes to literally cook, as this heats the water surrounding them in the wet cloth and also avoids evaporative cooling. We also only want to achieve no greater drop in temperature than 1 degree Celsius a minute to again avoid shivering and those pectoral muscles increasing body temperature instead of lowering body temperature. All active cooling should be stopped at 40 degrees temperature. But the most important thing is to still be measuring body temperature, because the animals are often going to go into shock because of dehydration, etc., and they very rapidly can become hypothermic after a while because of shock and the circulation starting to shut down. 10% of body weight of subcutaneous fluids, preferably composing 50-50 of Hartmann's and 2.5% glucose saline, should be given. Oral fluid should never be given to any animals coming in with heat stroke, because the gut blood vessels are going to be shut down and will not absorb fluid orally. This is only going to cause aspiration potentially. All animals that have been brought in for triage should always go to a wildlife veterinarian as soon as possible if this is available, because any animal that's been sick enough or down enough not responding to spraying will have significant cell damage and require medical treatment and will need to come into care. The decision to remove bats from the colony is dependent upon access to wildlife veterinarians, what wildlife carers are available, and resources that are available. All bats in this category will have heat stroke and associated organ damage requiring careful diagnosis and treatment, because even though adrenaline may allow some flying foxes to fly away, they will have cell damage, either gut damage or renal damage, which may come out a week to 2 weeks after the event. Intervention and triage should only occur via vaccinated, trained personnel only. They should be able to identify bats requiring immediate euthanasia first, and only remove bats for triage after they've given them at least 3 good sprays, achieving effective saturation, with a 15-minute break between each spray, constantly monitoring the bats as well as the other bats in the colony's response to the spraying and the presence of humans. Success is defined by the bats returning back into the mid-story. The picture on the left here is showing a flying fox before and after spraying, courtesy of Justin Welbergen. What we can see before is that the flying fox is a temperature very close to ambient temperature. After directly spraying the flying fox, we can see that the flying fox is now significantly cooler than the ambient temperature, which is a potentially life-saving procedure. If the bats are tolerant of a quiet approach, an attempt at spraying with water and a backpack spray can be attempted. Start gently with the stream as a good spray. We don't want to mist around the bats, because this can only worsen the situation by creating a mist cloud around the flying fox and avoiding their last means of lowering core body temperature. If a gentle intensity of spray is tolerated, gradually increase the intensity of the spraying so that each bat gets saturated directly with water. Move on to observe the next area and come back and observe the previously sprayed bats. After 3 good attempts at good spraying, those remaining bats that have not responded, i.e. climbing back to the mid-story, should be taken in for triage if vaccinated personnel are available. It should be noted that orphans should not immediately be removed that are roosting in trees, as mothers will often come back for babies once the situation has settled. It will become apparent over the next 24-48 hours if juveniles are truly orphaned. Assessment and complications of heat stroke. Measuring dehydration. So oral mucous membrane capillary refill time is one of the most useful methods of measuring dehydration. This is the time it takes for colour to return when digital pressure is placed on the gums and then removed. Normal is 2 seconds or less. Greater than 3 seconds is significantly dehydrated. It should be noted that this should only be done while wearing appropriate PPE. Physical signs of dehydration include loss of membrane elasticity, a dull demeanour, and eyes also starting to become dull and sunken. Membrane will often start to look papery or crepey when flying foxes are becoming more dehydrated. So clinical signs are one way of monitoring complications and dehydration. Gum colour, whether or not the gums are white, pale, pink, red, brick red, or blue. Gum moisture, so whether the gums are moist, tacky, dry. This also offers very good information for any wildlife vets or allows other carers to know whether or not the animal is improving or deteriorating. Oral mucous membrane capillary refill time is also good to know whether or not subcutaneous fluids are effective, because this should mean that the time should start to reduce back to normal, which is less than 2 seconds. If bats make it to a veterinarian, measuring PCV and total protein, which is packed cell volume and total protein, is a very good measure of looking at how dehydrated an animal is. And what this is looking at is the percentage of concentration of the blood. So we're looking at how much of the percentage of a little hematocrit tube is actually packed red cells, usually a little buffy coat of white cells, and then the plasma at the top. We can also measure the total protein in the plasma at the top, which becomes higher as more water is lost out of the blood and it's becoming more concentrated. So mild dehydration up to 5% is normally animals that have eyes that are slightly dull. The skin membranes are starting to become slightly inelastic, but the bat's still relatively bright. Around about 5% body weight of subcut fluids is always safe. Again, preferably 50-50 Hartmann's, compound sodium lactate, and 2.5% glucose and 0.45% saline is best. The reason that I like this combination is because the Hartmann's has bicarbonate in it, which often reverses any myopathy, and offering some glucose is always important in flying foxes due to their high metabolic rate, but also because of the exertion of fanning, etc., and the stress that they have been through. When an animal is less than 5% body weight dehydrated, you may be able to give oral fluids if very, very early with some glucose, but I would always use extreme caution. Gums may be normal to slightly pale. They may also feel completely normal to slightly tacky. The refill time will normally still be around about the 2-second mark or less. Moderate dehydration of about 5 to 10%. Eyes will be dull and starting to become a little bit sunken. The skin membranes will look quite inelastic. The bat will be starting to look quite flat. There may be exposure ulcers starting on the cornea from the watery part of the tear film drying up, and the oral mucous membrane capillary refill time will be at least 2 seconds or more. So measuring oral mucous membrane capillary refill time, again with our nitrile gloves, involves placing digital pressure on the gums and counting the number of seconds until gum color returns to normal. This flying fox in this video has a normal refill time of less than 2 seconds. So in flying foxes with moderate dehydration of 5 to 10%, oral fluids will not absorb, and there's a very real increased risk of aspiration during this time. So 10% body weight of subcut fluids, again, ideally the 50-50 solution is best. Normally done over the dorsum between the shoulder blades. It's not going to hit any vital organs. It's not going to cause any damage. It's very little stress, and it can be done quite easily on a triage table with a bat restrained with a towel, and that's it. The fluids should always be either tepid or body temperature. Place false tears in the eyes, and if not responding in 30 minutes, go to a veterinarian. That's again your placement of subcut fluids. Severe dehydration. The eyes are going to be incredibly dull and sunken. They'll often be holding them closed because of exposure ulcers. Skin membranes are usually dry and elastic and feeling very tacky. The mouth is often quite tacky and dry. They're often in a state of shock, and they quite often have exposure ulcers in the eye. This little guy has his eyes squinted shut because of severe exposure ulcers. These animals ideally need to go to a vet as soon as possible. They definitely will need IV fluids. Definitely no oral fluids, because there's no chance that that gut will be absorbing anything. Usually giving 10% body weight subcut fluids at least at rescue with, again, it seems funny to say to warm the fluids, but again, we're trying not to, when I say warm, I just mean warm to tepid or body temperature, because we don't want to stimulate shivering. Subcut fluids alone under these circumstances will not suffice, because the blood supply even to the skin, the gastrointestinal tract, and the peritoneal cavity are starting to shut down. It should be noted that the blood supply to the peritoneal cavity as well as the subcut or the subcutis close down at exactly the same time, which is why the author chooses to use subcut fluids over intraperitoneal fluids based on the safety of subcut fluids over intraperitoneal fluids and the pain of peritoneal fluids versus subcut fluids. Placing false tears in the eyes at this stage is also good. Here are the two products that have been mentioned as well. This is the Hartmann's, or the compound sodium lactate, and the other one is the 0.45 sodium chloride and 2.5% glucose, which can be mixed in the same syringe. Animals surviving the initial insults of heat stroke will have lost the lining of the gastrointestinal tract and therefore have minimal protection against infection entering the bloodstream from the gut. This is often seen after they've survived the initial insult of heat stroke or made it through triage. This can be seen as diarrhea that looks either very red, maroon to black with an incredibly revolting necrotic smell. This is incredibly important to note, because what this does is it leaves the entire gut lining open to bacteria entering and potentially developing septicemia. They will also have severely compromised absorption of nutrients from the gastrointestinal tract, as well as significant protein and fluid losses from the gastrointestinal tract. Surviving animals will also have very compromised renal function and may develop chronic renal failure up to quite a few weeks after the initial insult, resulting in protein, glucose, and electrolyte losses via the urine. So monitoring hydration afterwards, keeping fluids up, and also maintaining a very good plane of hydration is incredibly important. Providing gut protectants such as Carafate and smoothies, and replacing that protein is also incredibly important. The renal failure can result in some animals exhibiting ulceration in the margins of the tongue from ammonia in saliva, and further blood vessel damage manifesting as little vesicles or blistering patterns in the vasculature of the membranes from further blood vessel damage and thrombosis. If this occurs a few weeks down the track, it must be monitored very closely, as this is signs that the initial kidney insult has resulted in chronic renal failure. Maintenance of hydration and body condition is incredibly important. Protection from infection, giving a good nutritional plane, but also starting very slowly with small volumes frequently of food, as that gut is not going to be able to absorb a lot of food all at once. And recovery from myopathy are keys to getting flying foxes through heat stroke. Nutritional supplementation is absolutely vital to counter the loss of protein via the gastrointestinal tract and kidneys. Absorption of nutrition from the gastrointestinal tract, as I mentioned, will also be compromised until the mucosal lining recovers and is completely replaced, which can actually take weeks after the initial insult. High quality protein supplementation can be achieved via addition to smoothies and close monitoring of weight gain, and a gentle return to exercise and movement to ensure that contraction and loss of range of motion does not result as a sequelae to muscle damage is also incredibly vitally important. I hope you've got something out of this and feel that you're able to manage what is potentially going to be potentially going to be a fairly nasty heat stress season. All the best to all of you and good luck.